Hello everyone, this is Dr. Sarfraz and welcome back to my channel. Today we are going to discuss about the anatomy of tongue in terms of the papillae. So before that, let us talk about the sense organ tongue in the form of introduction. So basically it has a free end that is known as tip, which is in contact with the floor of mouth and also the gums and teeth around. It has a body which has upper surface and dorsum, known as dorsum, and the inferior surface and root. So the root is connected to epiglottis with the help of three glossoepiglottic fold. The first one is median and the two are lateral, right and left lateral glossoepiglottic fold. The space between the median and the lateral glossoepiglottic fold is known as vallecula. So the body or the dorsum is divided into two main parts, that is anterior 2/3 and posterior 1/3 part. Anterior 2/3 part is also known as papillary part because it is covered by papillae, and the posterior 1/3 part is known as lymphoid part because there are present of lymphoid follicles. So anterior 2/3 and posterior 1/3 are separated from each other by a V-shaped sulcus terminalis, and the limbs of the two V-shaped sulcus terminalis are connected in the center from the starting point of the median furrow known as foramen caecum. So papillary part can be elaborated in four papilla, that is circumvallate, fungiform, filiform and foliate. So circumvallate are nothing but 4 to 12 largest papillae just in front of sulcus terminalis. The foliate are on the margins just in front of palatoglossal arch. Fungiform are present on the tip and margins, and the filiform covers the entire surface, the remaining surface, the main bulk of the dorsum of tongue, and hence gives a velvety appearance to the tongue. So this was today's session regarding the papillae. The diagram is being provided. You can go through it. Thank you. The undersurface of the tongue has no papilla, only mucous membrane is seen, and there is a frenulum linguae in the middle. On both the sides there are deep lingual veins, and more laterally there are plica fimbriata. So these are the structures seen on the undersurface of the tongue. When we talk about the muscles of the tongue, there are four extrinsic and four intrinsic muscles: superior longitudinal, inferior longitudinal, transverse vertical, and genioglossus, styloglossus, palatoglossus, and hyoglossus. These are the eight important muscles of the tongue, whose origin insertion have to be studied into the detail. Then when we talk about the lymphatic drainage, the tip is drained into submental nodes, anterior 2/3 part is drained into submandibular nodes, and posterior 1/3 part is drained into jugulo-omohyoid nodes. Applied aspect of the tongue can be stated as acute glossitis, inflammatory condition of the tongue which can be associated with the angular stomatitis. Then there is, in dehydration condition, the tongue is dry. The tongue is fissured in syphilis. The tongue is bald due to atrophy of the papillae, then especially filiform papillae. The tongue is pallor or white coat is seen on the tongue in fever condition, then in toxemia, especially typhoid fever, and all the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by accessory nerve. So lesions of this nerve can be kept in mind while stating the applied aspect of the tongue. Thank you.